recently did a podcast on reductionism, and after we actually did the podcast, a strange thing happened. Um, Thomas Insel, the former head of the National Institute of Mental Health, came out with a sort of a professional memoir, which was described in the New York Times. And it was almost like the outline, which I'm going to read some of, the article outlined exactly what we talked about. Before we do that, I just want to refer to something in 1981, I published an article called Reductionism, the Psychology of the 80s in American Psychologist, which is the one journal that all members of the American Psychological Association receive. Thanks to Peter Nathan for helping to shepherd that in. And the first two sentences are: a growing consensus is emerging that the best hope for understanding and dealing with psychological problems lies with work being done in genetics, biology, and neurosciences. Research in the neurosciences especially is expected to revolutionize the treatment of mental disorders in the coming years. Well, that was happy news in 1981. And I quoted a man named Richard Resnick, who is not a neuroscientist, he's a neurologist, who wrote at that time, medical researchers tend to frown on over-enthusiastic claims about miracle cures and wonder drugs. Yet behind the scenes in medicine today, waves of high excitement are being generated by a group of biochemical agents called endorphins. So far, researchers have carefully avoided hyperbole, but it's hard to leave out the exclamation point when you're talking about a veritable philosopher's stone, a group of substances that hold out the promise of alleviating or even eliminating such age-old medical bugaboos as pain, drug addiction, and among other mental illnesses, schizophrenia. Well, that was happy news in 1977 when he wrote that, wasn't it? We were just about to eliminate pain, addiction, and mental illness. Thank God that that's happened. Now, Richard Resnick isn't a passive observer of all this. He wrote bestsellers called The Brain and the Mind, both of which were translated into public broadcasting multi-part series. So that an intelligent person, somebody wanted to do something constructive with their lives might be watching that and saying, oh my God, the cure to all of these things is residing in our brains, and they're finding all of that out. Well, I said in 1981, not only was that not true, but it was a fundamentally mistaken way of thinking about the whole situation. So I belong to a group of people who make that kind of a claim about the brain theory of addiction, which is associated with Nora Volkow, the head of the National Institute on Drug Abuse. But I might be the only one who makes that part of a larger critique. And Thomas Insel became head of the National Institute of Mental Health in 2002, the year before Nora Volkow became head of the NIDA. And he was, it's hard to imagine, an even more committed, fundamentally neuroscience, biochemist, addiction therapy guy. He was a
Thomas Insel?
Psychiatrist.
We're talking about Thomas Insel?
Thomas Insel,
Yeah.
right. It's hard to say he was more so. I mean, Nora Volkow in the early years said it's all about the dopamine. So Insel himself was the head of the NIMH from 2002 to 2015. And his new book is called Healing Our Path from Mental Illness to Mental Health. He led research into psychiatric diseases for 13 years, and he says the advances in neuroscience have yet to benefit patients. So remember, Resnick was writing in 1977. Insel came in to head the NIMH in 2002, and he's sort of going, well, it didn't really help us yet. I should have been able to help us bend the curves for death and disability, Dr. Insel writes, but I didn't. And as we point out in our other podcast, there's strong evidence that America is doing worse than the rest of the world.
Mm-hmm.
So I'm going to read from the New York Times article, which sounds almost like an outline of the podcast we did on reductionism, except this only came out afterwards. He calls the advances in neuroscience of the last 20 years spectacular, but they haven't actually helped anyone. It calls out a paradox. This is in the New York Times. The United States, a country that leads the world in spending on medical research, also stands out for its dismal outcomes in people with mental illnesses. And obviously, we would say the same about addiction. Indeed, over the last 3 decades, even as the government invested billions of dollars in better understanding the brain, those outcomes have deteriorated. Well, that's something we could ponder on that. You know, if we were doing a group in front of us, we might say, we had tremendous high hopes. We invested billions, and outcomes have deteriorated. Because as we said in the podcast about reductionism, Americans still feel, and I think include in this certainly most psychiatrists and most psychologists, and many psychologists, well, it's just a matter of time. We haven't gotten where we want. In fact, things have gotten worse in the last 10 and 20 and 50 years, but we're getting there. Dr. Insel rose through the ranks at a time of optimism that advances in neurobiology would lead to new treatments. And as head of NIMH, he put it, he bet big on genomics. But 20 years later, he said the role that genes played in schizophrenia and bipolar disorder has proved to be extraordinarily complex. And we discussed this in the podcast. Each of these variants that have been discovered just account for a tiny amount of risk. So in aggregate, they're probably significant, but you have to put 100 of them together. So we started doing bigger and bigger studies to find smaller and smaller effects. God bless her. That's Maya Salavitz's big data approach. You don't actually have there's no gene, as we went over, for bipolar or schizophrenia, but you can do these complex multivariate analysis of the chromosome and say, well, this contributes. Altogether, it's still a small amount. But then you get down to the question, well, what does that tell you? What can you do about that? You can't modify every aspect of a person's genome. For starters, how does it translate into actually doing anything? I don't think and this is Insel, Mr. Neurobiology Reductionism. I don't think focusing on finding these very small effects signals for common diseases is how I want to spend my time, which he spent 13 years doing and spending billions of dollars doing. I realized, wow, we could continue doing research until I'm in my 90s, but if we can't get this stuff actually implemented, what's the point? And with all due self-respect, in 1981, I said that. In the book, he describes an epiphany during his last year at NIMH. After he had delivered a PowerPoint presentation to a group of advocates touting researchers' progress on genetic markers, a man in a flannel shirt, funny you should remember that, isn't it? Got to his feet and reeled off the story of his 23-year-old son who has schizophrenia, a cycle of hospitalization, suicide attempts, and homelessness. That's a story we've heard. The man said, "Our house is on fire. And you were talking about the chemistry of the paint. What are you doing to put out the fire?" In that quote, Insel, from the book, "In that moment, I knew he was right. Nothing my colleagues and I were doing addressed the ever-increasing urgency or magnitude of the suffering millions of Americans were living through and dying from." So, I wrote a memoir called Scientific Life on the Edge, My Lonely Quest to Change How We See Addiction. And I'm kind of viewed as a pain in the ass until this day in the addiction field. And yet that question he's asking that man asked. And then he's thinking about, we're having ever increasing levels of death and disability due to both drugs, and the global burden of disease study put America at number 1 and 2 in 195 nations in disability and death due to anxiety and depression on the one hand, and to cocaine, opioids, and methamphetamines on the other. People are dying in mass, and yet for some strange, it strikes me as psychotic reason, reinvesting in those very approaches. And Insel, who came up when they were doing that Richard Restak Brain and Mind series, is somebody who's completely steeped in that line of logic, and he still is. And now that he's retired in 2015 from NIMH, he's finally asking himself, but wait a second, is this really actually helping us to deal with these problems, which all the data show are getting worse? And he's having a crisis of confidence. And what I've been saying and what I continue to say and what the Life Process Program and the Natural Recovery Movement embodies is what we're doing is not just accidentally off topic. Oh, we transferred billions of dollars away from helping therapies and resource provision to biochemical research. It's that way of thinking, that biological, neuroscientific, genetic reductionism is actually the source of our problems. And
let me say, can I mention something that I did my own research after I read that article, because honestly, I didn't know who he was. And so here are things that he said, just really quickly. Said that we have, he was able to realize, this thing's falling down. There was things right in our frame that for some reason nobody is willing to see or nobody can see. So an issue with just mental health in general, psychiatric help, whether it's some other kind of psychological or social work, is there's a lack of engagement in it. And he used to think of that problem as, well, that just means that it's not available enough. But now he realizes it's more like, and I'm paraphrasing, this is my own words, like there's a helper reaching out their hand to someone drowning and they refuse to take it. And so there's something there that we need to reconcile.
Why would that be? Failure to implement, he's saying, which is a lot like MOUD, medications for opioid use disorder. We've got these great things. People aren't using them. What the hell's the matter with them?
Right. And so his next point is, now that he could get away from the usual, right, just like MOUD, it's like, well, we have this awesome thing. We just need to put more of it out there and more people access it. No, it's lack of engagement because people don't want to engage with it. Well, and that's partly because he says, lack of quality. It's a broken system. We deal with things in an episodic, reactive way, and it's not helpful to people. So even when people access it, it's not helpful, and they're aware of that. And then lastly, there's no accountability. So we're not really measuring outcomes. We're patting ourselves on the back. And then he goes on to
outcomes, but we're not taking them seriously because we know the outcomes are dismal.
Right. We aren't taking outcomes into account. And so he puts together this, he says, really, if we could just narrow our focus on these very easy things. This might sound familiar to you. Something like this might sound familiar. He said, let's just focus on 3 Ps: people, place, and purpose. People being people need social support. Place, having a sanctuary that's safe, nurturing, and supportive. And purpose, giving or allowing people or helping them find something to do, having a mission or having a purpose. If we could do those things, then we could get back on track in terms of the mental health system.
That's unbelievable. Of course, those are the 4, we talk about the 4 pillars of recovery, which a conglomeration of addiction and the mental health therapists put together, which is purpose, a life place, resources, and self-efficacy, feeling that you can really make a difference in your life, which are fundamentals of living that are not only unrelated to taking medications for the most part, but in many ways those are deteriorated or combated by a reliance on these external forces. So I'm really glad you pointed that out. Insel, when you hear him talk, he says, well, we didn't implement it. That sounds like, which is what they say about MOUD. We haven't given enough people all of these drugs and medications, which are so helpful. But the way you put it, he's saying something totally different. He's leaping to another plane of existence. Person, purpose, and place. That's as fundamental as you're going to get about a human being. Nora Volkow is in that same netherworld. I point out in December 2019, she has a blog. And in 2007, she says, I must say it 10 times a day, 12 times a day. It's all about the dopamine. In 2019, she says, every time I go someplace where there's terrible addiction and death outbreak, opioid death outbreak, the people there all tell me the same thing. We need to get people involved in life. We need to have them help get healthy. We need to have them have housing. We need to have them get educations and have a purpose in life. So she has been slapped back by that recognition. But even so, she continues to defend, like Insel sometimes does, the whole disease theory. Yes, but it's this brain disease if we can only get to it. And it's sort of something like an interim process. But in the meantime, people need a place to live. They need to have a purpose. They need to be healthy. She is prevented, like Insel often seems to be, from making that leap to understanding that those are the fundamental things. And the purpose of our discussing reductionism is to make clear that our whole miscast way of thinking is not, in a way, diverting attention. It's bypassing what's necessary. It's actually undercutting the things that need to be done. And so his $3 billion reinvestment, which is the United States government has shifted a tremendous amount of money away from assisting with education and housing and health to addiction therapies and medications and mental health medications. It's an actual choice that we've made. And the bottom line has been, as Insel points out, people are dying. And we're at the bottom, and the mental health measures and addiction measures are deteriorating. And we stand at the bottom of the ladder in the world in measuring those and how well we're doing by those outcome measurements.
I would like to get your take on something. I've encountered this with career psychologists or psychiatrists who often bought into the system. They practice what they learned. But it seems like as they are approaching retirement, or as that, once they have a plan to settle down, or once they retire, then they're able to sort of talk about these things in a more fundamentally common sense way. Why do you think that is? Why do you think it takes that long?
When you bring that up, it reminds me of that. My mind wanders. It reminds me of the documentary, The Fog of War. When I went to teach at Harvard Business School, I was 25, and the person who was famous for teaching at the Harvard Business School before then at 25 was Robert McNamara. And Robert McNamara came and taught at the Harvard Business School at 25. He became president of the Ford Motor Company, and then he became Secretary of Defense during the Vietnam War. And what can you say? He was a very smart person, and he defended the war. And then when he retired, they did the documentary, The Fog of War, and he said, well, you could see that we were sinking in a mire from the get-go. And then the interviewer did a fairly good job motivationally interviewing. He says, it's funny that you should make that statement now, but you're nobody now, You're just like a guy I'm interviewing.
Yeah.
To be the Secretary of Defense.
Yeah, couldn't you have said that then? Yeah, exactly.
Couldn't you have? I mean, life doesn't work this way. Couldn't you have gone into Lyndon Johnson and said, this war's crappy. We're cutting ourselves down. It's going to ruin your whole legacy. But that's just not the way that life works. Insel was engaged. He was brought up in this way of thinking. He was in the process of diverting money in that direction. And now that he's no longer doing that, now that he's retired from that, I mean, he got involved in some Google brain disease thing. He's got a chance to rethink his whole life. And like McNamara, you know, at times he sounds like the biggest radical. You know, McNamara, in this interview in the Fog of War, he sounds like, you know, SDS or something. You know, he sounds like he was leading the anti-war movement. So the question is, can we ever extract people from those kinds of situations? Can we get them, can we advance their thinking without having to go through the life process of becoming an old person, retiring and saying, I wonder really whether my life was valuable. That's what we're trying to do. And, you know, just to mention my own career, A Scientific Life on the Edge, My Lonely Quest to Change How We See Addiction, which is still going on. I'm 76. I'm trying to stop and shake the field and say, what are we doing? What are our outcomes? Let's rethink from the very basic get-go. And, you know, you end up in Insel, the way you wrote about it. I mean, it's, forget the 4 foundations of, you know, self-efficacy, health, a place to live, and purpose. He's got it down to 3. Yeah. Person, place, purpose. It's almost like, well, it's embarrassing. You don't need to get, you know, a medical degree from Harvard to be able to come up with those 3 things. So it's almost embarrassing. Now that he can relax, sit in his back porch a little bit, he can say, you know, those are really what we need to be focused on. By the way, I attended 2 major things where of drug prevention. When I was in Morristown, my kids were in high school, I went to see a guy present. He's famous. He spends 5 hours talking against alcohol and drugs. Not one question was asked by the students. So I actually went to a Board of Education meeting, and I said, you brought him in, was his name Palumbo? What was his name? He was famous for a while. You brought a guy in, how much did you pay to have him speak? And, you know, the head of the Board of Ed said $5,000. And I said, and so that's how you thought you would invest $5,000 for drug prevention? And he said, well, it wasn't actually our money. Somebody donated it. And I said, it's still $5,000. I said, is that the educational, did you go to graduate school in education? Is that the educational technique that worked, that you were taught? Bombard kids for 5 hours with your cockamamie ideas? And he said, well, no, but this is so serious, we thought. And I said, so you're thinking that the educational techniques that involve engaging children and thinking about themselves and their lives, throw that out the window when it becomes really important because of drugs? That's your logic? You're the head of the Board of Education, and that's how you're. And then I made the modest suggestion. This falls in the category of a scientific, it's a life on the edge, not a scientific life on the edge. I said to the Board of Education, well, should we fire this man? He's a man who he believes that just bombarding children with propaganda is the way to educate, even though he's been trained the opposite. When push comes to shove, he discards that whole approach. Is this the man that we need to pay a salary to head the Board of Education? And it was a Morris school district.
What an interesting question. And I guess that's the question that people, when they're in their career, like Insel, he was never questioning the dynamics of what they were doing in the middle of things. And that's something that you have a gift of doing. You don't mind bringing that up. And so now I need to know. So what was the response?
In my, everybody was uncomfortable. They couldn't quite kick me out. I was kicked out of another meeting in a neighboring township when I raised these questions. The head of police, they were, actually had me escorted out of the building. But that's sort of, in a way, that's what I do in the entire addiction field. I don't belong to any group. I question every group. For example, the harm reduction was pushing like crazy for reducing opioid prescriptions, which happened, and deaths increased. Now they're pushing for MOUD. The government just published a study which said that in 75% of the nation now, MOUD is available. And I go, wow. Because the standard line is, well, we're not pushing medications enough. We're not telling people that the only way they're going to get away from opioids is by giving them essentially opioids. No amount, all of the groups that are presenting ideas that sound like mine and that in some ways I'm associated with, I sort of just raise my hand and say, are we really doing what we're supposed to do? At the inception of, Filter, I met a woman who I had seen on stage promoting. She was head of the New York Medical Association's harm reduction unit, making sure that people couldn't get painkillers. And when I said, is that really, what is your logic? How is that helpful? She got tremendously aggravated with me. So I'm always a scientific life on the edge. I'm always in danger of teetering over myself and falling off because I question everyone's assumptions in terms of basic values. And it's remarkable to me the degree to which psychologists and harm reduction people fundamentally believe the Insel Norvolko model that addiction is a chemical misreaction in the brain. That's really what a ton of people fundamentally believe. And unless we can question that very basic outlook, we're never going to make any progress.
We've had this conversation a million times, but you don't mind challenging the assumptions in the moment. And of course, we call it a gift and a curse. We talk about our different personalities, and my sense is that I'm people oriented, so I care about that people have their reasons for doing things, and I'm a slow burn, so I believe things with fervor, but I also try to adopt what people are saying to me and understand, and it's sort of like a clinical relationship I might have. And so that the problem with that is that it takes a lot of time and perhaps wasted effort. The problem with your approach could be that people feel immediately challenged to the extent that they shut down. I was thinking about, maybe there needs to just be a position in all fields where someone like Insel is able to come consult. He's retired now. Now we can come consult and ask, are we doing these fundamental things? And, work with enormous agencies to do that. I guess they kind of have that, but.
Well, we've noted these differences, and, there have to be people like me, and God bless, to have to be people like you. I don't know how much you're able. You and your wife are both involved now in fundamental agencies. And when you're involved in fundamental and you both have an outlook, it's in line more or less with my own.
Mm-hmm.
And, I'm constantly marvel. I almost think I wrote a recommendation for you, honestly. While I was writing it, I thought, is this really going to help him? You know what I mean? I sort of worry somebody's going to look me up in the internet and they're going to say, oh, the hell was Zach Rhodes? And so you're engaged in an opposite task from mine, which is to sort of shine a light in dark corners on my part and say, you're thinking about everything wrong. Get on the stick. And you and your wife, she's working with a helping agency with homeless and related problems people. You're working in a grade school educational facility. And you're both taking my kinds of ideas. They're not, you got your own ways of thinking and implementing them. And, I sort of, I marvel at your ability to do that. B, as I said, I sort of worried, I hope they don't, his involvement with me doesn't screw up.
Right.
Is getting the job. And then finally, as I often mention, I'm 76. You're maybe less than half my age. You've got a few years going forward, so you've got a little bit of time on your side. You go at a slower pace, but I'm part of me is thinking, well, this is how. Apropos of the questions you're asking, people are involved in organizations, and while McNamara is running the war in Vietnam, he seems like he's incredibly pro-war until he retires and said, "What a crazy thing we were doing." You're trying to jump that gap and say, well, I'm going to be involved in the institutions. Somebody hires you to do this, so they have some feeling that this is a good way to go. And now you have to navigate that chasm, between, saying something like, we're doing things wrong in many ways, but I'm on your team. Here's how we can move in a more positive direction. Right. What can I say? It's a life skill and a life outlook. Obviously, there's no guarantees of success, but I hope I'm not giving away too much. You and your wife both live in Vermont. It's not New York City. It's a very small state. People know you. You're both Vermonters. Your parents are in Vermont. So it's not like you're outside agitators. You both worked in various agencies. So people say, okay, they're good. They can work with us. And so you're a little bit of a life experiment about, how much can people be reoriented from an ongoing institution. Are you able to, I don't want to blow your game. Are you able to say that this is possible in progressing this effort on your family's behalf?
I think it's possible, or I wouldn't still be doing it. It's like anything that I've ever done. I set out with an idea of how it might work, and I think I'm just going to have to adjust along the way. And I'm trying to be careful not to get so involved with the system that I don't like. It's like I work in the school system, but I don't really like school systems. And on the other hand, they're necessary for some things. And so I'm proud to work among people in the school system and do the best I can, and encourage others and learn from others. Is it possible to implement like a Stanton Peele style of thinking from on high? Actually, I don't know, but I'm damn well trying to do that. And as I go, I've been writing little essays, kind of like a journal to myself, that I intend to get out there as a book at some point about school systems. So, if all else fails, at least I'll have some documentation to.
Am I allowed to talk a little bit about? I know hardly anything. Your wife's involved in an agency, and she's implementing a Peelean, Rhodesian view of harm reduction. They do drug testing, and in general, you're out if you're taking drugs.
Yeah.
And she's trying to implement our concept of harm reduction, which is, well, how are they doing in life? That's what we're looking for. The drugs thing, we're concerned when drugs interfere with how you deal with life. We sort of don't care about drugs, you know what I mean? Drugs aren't what our whole shtick is about. And that's a fundamentally different worldview. And I know your wife a little bit. She has some gift, like you do, for not banging people over the head with a big stick and saying, schmuck, you're thinking about it the wrong way. She sort of has a way of gradually being more constructive. And, I have no idea how she does this in real life, but asking, well, let's think about how that person's doing in life. That's what we're thinking about. And let's change our focus over in that direction rather than, what this drug test shows.
Yeah, let me say this. Sam is my wife, Sam. is, first of all, she gets things done. If you give her a task and she's accepted it, she will get it done. And you can always count on that. Now, and she also has a remarkable way of understanding people. I mean, it doesn't matter she could be talking to a serial killer, she could be whoever it is, she'll understand what makes them tick because she just has a gift. And right now, she's working in an agency with people who have their faults and have their, their strengths. And she's tasked with directing this organization. And one of the things that she does and knows to do is to treat people with some, common just respect and help them move forward. And what she's noticed, so she has the task of sort of changing things in her own agency or, implementing strategies that are really help people connect with the people they're serving. And she noticed that there's outside agencies that they need to report to, and they need to be honest in the reporting to them. And it's tough to understand, what needs to get reported and what can you say, hey, go piss off. And then when you report something, what effect is that going to have? So like the Department of Children and Families, if they want to know from you, a clinician, did this person pass a drug screen? And you say, no, they had this in their system, they might take their kids away. So she sees this as a task. And like I said, she gets things done. So one of her tasks is we need to figure out exactly how we're involved with these outside agencies. And her basic message to them is you need to give some room to do our job. If you're taking people's kids away at the same time as we're trying to help people, we need to figure out a way that we're communicating here. So that's her new task, is trying to figure out how all these external agencies, whether it's legal or, some other system that her clients are in, how can people both communicate with them only enough that they've done their due diligence, but also how can things possibly change? And this might be at a legislative level, it turns out, so that people can stop bugging them, the actual people who are helping these human beings. So that's a task.
You and your wife are both avoid being drama queens and kings. You've got that ability to process information slowly, and yet you're asking the fundamental question, which Insel's only coming to grips with. In 2007, Nora Volkow was interviewed, a general in the drug war. Well, we're now facing problems with painkillers. Those problems have multiplied 5 times since she's been in office. They're failing to ask the question, what's the basic outcome here that we need to be focused on, and how are we doing? And for some reason, you and your wife are gifted with the ability to cut out all of the fog and say, well, and hone in on where are we headed with this? What's our job supposed to be? Can we get all of us on track with that and cut out there's a Yiddish phrase, hazarai, which is junk, like junk food?
Well, I would have recoiled at talking too much about me on your channel and your talk about reductionism, except that this is an interesting challenge. That am I going to take my own medicine? I can criticize somebody for not calling things out or trying to restructure things the right way until after they retire. But as you say, now I'm in the thick of things, and if I'm to be taken seriously, then I actually need to be working to do what I'm saying.
With mixed success, you've been in the thick of things before. I mean, you've worked in school systems, and people come, like your wife, they say, well, he sort of gets things done. What he gets done, we need. We have children who are not mixing well in the mix.
Right.
Zach can deal with them. He is a little kooky, but, that's a job we need to get done, and he can do it.
Yeah, that's right.
You had less success in your county commission on opioids. They liked you. They didn't dislike you. They just disregarded every crazy thing you said, about, getting back to the director of the New York Medical Association, crushing the intake, removing the use of painkillers. Everybody's so much on that track that that wasn't a situation you felt comfortable in. So you're going to do better in a situation where people are, they kind of know you've got a success record and you're demonstrating that what you're doing is working for them right now, which is a little more manageable within a given educational system than in the state of Vermont, an opioid desk where you're one member of a panel of 10 or 20 people.
Very well put. So we were able to discuss part 2 of reductionism, that you talked about some of these issues 40, almost 50 years ago. We discussed Thomas Insel, who now has come out with a memoir explaining that psychiatry is junk right now. And we've kind of mapped that onto what I'm trying to do as a young person in the field. And, that's sort of an ongoing, we can check in and see, what kind of progress I'm actually making. And it's a good case study.
I don't know. We couldn't have covered the waterfront any better than that, Zach. Thanks for helping me do that on my network.
Thank you, Stanton.
Au revoir.